Oh, well, let's get to it. Today's July 26th episode of the Trouble Wars podcast. I'm your host, Sharky. Tonight, I'm going to give you guys a very shocking expose into the Affordable Care Act, its impact that it's had on the Black community, and myself in particular. A lot of pundits came to the YouTube channels expressing their concern over the Affordable Care Act and the harms that it has caused to the Black community and the American public all around. Very few of them, although their claims are much substantiated, have been able to point out with pinpoint accuracy the deception that's been practiced in the healthcare system under the Affordable Care Act. Recently, lately, I'm sure you guys have seen if you've been paying attention to the news, a lot of events surrounding healthcare fraud, a whole bunch of major cases. I'm a victim of healthcare fraud. Tonight, I'm going to explain part one, some of the things that I experienced. You probably don't want to pay attention because I ain't telling any names, doctors. Some of these doctors are practicing medicine at the highest level. And it's probably a high probability that one is yours. So with that, I would like to say everything is under fair use. Some of the content has been altered or mildly modified for streaming purposes. So, yeah, man, let's get on. Y'all in for a doozy. This part one, we ain't never seen nothing like this. So we're going to get right into it. Yeah, give me a little time. I'm trying to work out a few little kinks. Bear with me. Mm-hmm. Here we go. Showing you guys.
With me for a long time, and you're in charge of the committee.
Indeed, one of the reasons I wanted to see it was the overruns of the expenses, wanted to figure out why.
Yeah. So we're taking a look, and it looks like it's about 3.1 billion. It went up a little bit, or a lot. So the 2.7 is now 3.1.
I'm not aware of that.
Yeah, it just came out.
I haven't heard that from anybody from
It just came out.
Yeah, it just came out, man. That's how
I noticed that at about 3.1.
exposed the Affordable Care Act. Look like we did now.
I don't know who does that.
That's what you're about to get tonight.
You're including the Martin renovation.
So the day is July 7th. I guess it's what time is it? Maybe 3 o'clock or something like that in the afternoon. Heading on up to North Baltimore Drive. They just had a major Medicare fraud bust about 2 weeks ago. 324 people got arrested, and they say they looking for somebody to come and tell. So I've been trying to tell for a while. I've been trying to tell. I want to tell before Congress. I want to tell before the Senate. I want to tell on everybody. Mm-hmm.
Yep, that was me on July 7th, going to the FBI office, field office up in Woodlawn, Maryland, Baltimore. Um, I've been there twice actually. First time I went there was during the Biden administration, as I said in that video. The reason I went there was because I'm gonna share this on my screen with you guys as to why I went. That's why I went to the FBI field office. It was there. I went there for a criminal referral to find out why no action had been taken. This criminal referral right here, 3261162 SKW from the administrative section of the Department of Justice, was issued on February the 6th, 2024. Yep, more than a year ago. It involves insurance fraud that was committed under the Affordable Care Act and under Medicaid and Medicare. Fraud against me. Fraud against me. So, during the pandemic, I took ill. I sought treatment in Kaiser Permanente of the Mid-Atlantic region, 815 East Pratt Street, Baltimore, Maryland. We'll put these doctors' faces up on the screen so you'll know who these doctors are. Now, this stuff that I'm going to provide tonight is alleged. All of it is factual, documented, and I'm going to walk y'all through it. I'm going to walk you through it. So, let's get back to the video.
Thank you all for joining us today as we announce the largest coordinated healthcare fraud takedown in the history of the Department of Justice. Today marks a decisive moment in our fight to protect American taxpayers from fraudsters and to defend the integrity of America's healthcare system. We are announcing today charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs. Criminal someone else's money.
That number, when you talk to someone.
All right, y'all. I'm just gonna pause this so y'all can go back. This is me at the FBI. This is me at the FBI. This is me at the FBI.
Involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid,
That's me
and
at
other
the
healthcare
FBI.
programs.
Trying to get some help.
Criminals didn't just steal someone else's money. They stole from you.
First time I went there was during the Biden administration, and could you believe they say you can't come in there and report a crime? Can you believe that?
Not coming from right. That's what I'm saying. So what I need to do to get somebody from upstairs down here?
Call that number.
I called this number. If I call this number, good.
Call that number. When you talk to somebody on that phone, ask them for a supervisor, because we can't ask them for a supervisor.
I'm gonna call them right now. I called the number last time.
Experiencing a mental health crisis or seeking mental health resources, press 1.
Yeah.
In a few moments, you will be connected to an operator. This call will be recorded for quality assurance, investigative or other purposes. If you do not wish to be recorded, please press 1 to receive details on how to record electronically, and this call will then be disconnected. During this call, you will be asked to provide identifying information about yourself and or the persons about whom you are calling. These questions will ask for information regarding name, date of birth, telephone number, and address. For the best accuracy, please do not use speakerphone or provide this information. We use this information to assist in investigating your tip. You do not have to provide your name or other personal information. However, the lack of information may delay or hurt our ability to investigate your tip. Any information you can provide.
No, what we doing?
Just saying, another day at the FBI again. Can't get no help. Give me the same number again. Y'all know I got all the paperwork. Insurance fraud, Medicare fraud, Obama fraud, and protection by their own government. I'm gonna unravel all this. I'll talk to y'all.
So that was me at the FBI with the DOJ criminal referral for the doctors who committed the crimes against them. All members of Kaiser Permanente of the Mid-Atlantic region. The Mid-Atlantic region for Kaiser Permanente, those of y'all don't know, the audience that's out there consists of Maryland, DC, and Virginia. The criminal referral reads, thank you for contacting the Department of Justice on August the 1st, 2023. We have received the information you provided and have determined that the complaint raises issues that are more appropriately addressed by other federal agencies. We are therefore referring this complaint to the following agencies for further action. Department of Health and Human Services. Right? It came from the Department of Health and Services. Now what I'm about to do, I'll get right to it. I'm getting ready to list these doctors that's involved. He's particularly dangerous. You want to pay attention. His name is Dr. Syed Afraiz Salahadi. He's the chief neurologist for Kaiser Permanente of the Mid-Atlantic region. Kaiser Permanente of the Mid-Atlantic region only has two chief neurologists. You happen to be one. At first I thought he was probably of Indian descent because his last name, Salahadi. But then I get a little further more deeper. And he's not Indian, he's Arabic. I believe probably Turkish, I don't know. But he practicing medicine in the United States at the highest level, no doubt, as a chief neurologist. Again, his name is Dr. Salahadi. He first. Second one you want to pay particularly note of is this gentleman here, Dr. Mark E. Wilson, MD. He currently works at 815 East Pratt Street. This guy's dangerous and shouldn't be practicing medicine. The criminal referral that I showed you guys at the beginning of the podcast, both of these guys are involved, heavily involved with that criminal referral. That involves insurance. There's more. Yes. Now, Shirley Tanya Mason. Shirley Tanya Mason. She's extremely dangerous as well and compromised. Have no regard for life, violate the credit goal, and turn it back on. The reason I'm showing you guys these pictures of these doctors is because I will show to you that they're guilty and that criminal referral should have been enforced a long time ago. Should have been enforced a long time ago. But these doctors are still out here practicing. Still out here practicing. This one here, Shanita Chase. Shanita Chase. Yeah. She told me we denied the medical service items listed above because occupational medicine related to employment are not covered under your health benefits. Take a good look at this, Dr. Two, Shanita Chase. All right, there's more doctors to go, but I want to get you guys caught up on to really what they really did to me. All right? Let me get you guys caught up on really what they did to me.
Filter on it in order to be assured that it's safe.
First in the news now, the second day of the massive Kaiser Permanente strike is bringing the issue of staffing shortages in healthcare to the forefront. KTLA's Alina Abovian is live in Baldwin Park with the latest. Good morning, Alina.
Eric, good morning. And that's right. You said it. Staffing shortages really is the number one issue. Right here behind me, these are that work at this hospital, and they are on strike this morning. This is day 2. Now, I'd like to bring in Nataya Palacio. Nataya, you're an LVN. What's the message from all of you guys?
All we want is for Kaiser executives to come to the table and bargain in good faith. That's all we're asking for.
But they are bargaining, and they say they're bargaining in good faith. You've already reached some tentative agreements. That's according to a Kaiser rep. What is it that you guys want that's not being met?
If they had come to an agreement, we would not still be out here. Them be out here. We want them to stop outsourcing. We need more staffing so that we can provide quality patient care. We are out here for our patients. At the end of the day, it's about patient care and patient safety.
And talking about patients, we have 1,000 people here at this outside this hospital. So if you guys are out here, who's inside taking care of patients?
People who come from registry who do not know the Kaiser system and management.
What has it been?
Historic settlement involving one of the biggest names in healthcare. Kaiser hospitals will pay tens of millions of dollars for illegally dumping biomedical waste and the medical records of into public landfills. NBC Bay Area's Robert Honda joins us from San Mateo County, which is one of the 3 local counties that started this investigation.
So y'all kind of get a gist for what you're walking into when you walk in the Kaiser Permanente. You walking into a situation where they telling you, and all this happened during the pandemic too. All this that actually took place, the crimes that was committed, all this was taking place during the pandemic and after the pandemic. But that was the type of environment you walking into in Kaiser Permanente, where they got administrative people handling you. They got people that's not familiar with what they're doing, taking care of you. And that's what I walked into when I went in Kaiser Permanente seeking treatment. I'm a Brown Department of Environmental Inspector. And what I do for a living is I inspect fueling plants, or what I did for a living, particularly for the state of Maryland. Particularly for the state of Maryland. And recently it was just a big oil spill down at the Baltimore and the Harlem. If any of you guys out there that work in environmental and you work with the Maryland Department of Health, you're going to want to pay attention to this as well. But it is my license right here. I've been certified since 2018. Right? So I'm an environmental worker. I mainly work with ethanol petroleum. I specialize in underground tank systems. So during the pandemic, I fell ill and I went to Kaiser Permanente. when I first got the Kaiser Permanente, remember the guy I told you I met was my primary care physician, was a doctor named Dr. Mark Wilson. So when I got to Dr. Mark Wilson, he ran a lot of tests on me. This guy here, he ran quite a few tests on me. Then he came back and he diagnosed me with alcohol-induced neuropathy. He said right here, "Good day, Mr. Allison. Think the fact that you have a history of being a storage system inspector who have exposed to alcohol has been noted." So he's telling me at this particular point that he knows the fact that he diagnosed me with alcohol-induced neuropathy and that I got insurance. So I thought everything was cool. It was during the pandemic, so I expected things may not proceed the way that they normally would typically proceed. So after several, I began to start questioning them. About the quality of treatment, the quality of care I was receiving, and the treatments that I was receiving, and the medications that they were prescribing. After several delays, I reached out to the Maryland Department of Health. I had contacted the Maryland Department of Health in 2021 by that time, and I had spoke with a nurse investigator and asked them to investigate whether or not my insurance had been properly documented and why I hadn't been seen by occupational medicine. Kaiser Permanente of the Mid-Atlantic region does not provide occupational medicine. So my personal care physician, which was Dr. Mark Wilson, he was well aware that I had insurance coverage. So after I contacted the Maryland Department of Health, the Maryland Department of Health notified Kaiser Permanente on December the 12th, on December the 8th, 2022, that my medical records had been altered and that my insurance coverage had been derailed. Prior to that, Dr. Wilson kept on trying to force me into having back surgery. And I kept saying, "Why do you keep sending me for all these MRIs and all these things concerning or having to do with my back?" Sharky Wilson kept stalling. So when I reached out to Maryland about the situation, the state of Maryland contacted me back. And when they got back to me, they sent me this. Let's read. It says, "Thank you for contacting the Maryland Department of Health regarding your Health Choice Managed Care Organization, MCO, Kaiser Permanente, your medical provider, and Maryland Board of Physicians concerning suspected alterations of medical records. Correspondence has been shared with the Maryland Medicaid Administration Office and the Medical Benefits Management as the appropriate agencies to respond. Our understanding that your Kaiser Permanente provider has amended the clinical documentation we originally logged within your medical records. However, Maryland law prohibits the complete removal of any clinical documentation Maryland Department of Health encourages you to continue working with your Kaiser Permanente case manager and legal representation to pursue further action. Investigate your claims and seek a resolution with your provider. This was on January 20th, 2023. Maryland notified Kaiser Permanente of the breach, which is a violation of HIPAA. In December. So since this time, I've been trapped into the Affordable Care Act, leaving the government for care and services that I don't qualify for. As I stated, I have insurance. As I previously told you, I have insurance. All right? And they're just going to treat me out of what I paid for, my insurance, my equity, and my health care. Just flat out. Let me show you. Here they go. This is some nasty work. They've been doing this with me for 2 years. Probably around right here. June 24, 2022. They know I got insurance, right? Know I got insurance. Just gonna ride me out of my coverage, though. Just wanna ride me. Not only do I got insurance, check this out. Not only do I got insurance, they got a claim against me. Yeah, not only do I got insurance, but they got a claim against me. Our office represents Kaiser Midland. Information we have received indicate another party may be responsible for causing the injuries and that you are making a claim against that party or their insurance company as a result of the injuries. The date of loss, 7/28/2020. You got a claim against me. Huh? Got a claim against me. So let me tell you what they did. Let me show you how the work that everybody be talking about the fraud that's going on and nobody gonna show y'all what the fraud is. Nobody never showed y'all what the fraud is. How we do it. Bet y'all wanna know. I know how to do it. Mm-hmm. I know how they do it. Let's watch a little bit more of this video. I know how they do it.
And address. For the best accuracy, please do
Down
not
here,
use
down
speakerphone while providing this.
here. Mm-hmm. We're gonna get to that. We're gonna get to that.
San Francisco and Alameda County began undercover operations after 15 Kaiser facilities were disposing of hazardous waste and patients' records into public landfills. Attorney General Rob Bonta bought the DOJ and found the DAs were right.
If they don't follow the law, if they're careless with dangerous waste or sensitive information, the potential for harm is enormous and it's widespread.
Wearing equipment similar to this 2007 search, crews from the counties spent long hours looking for evidence.
Most people refer to as dumpster diving. We call it waste inspections. There are a lot of dangers involved because, again, I talked about the pathogens that are basically in biohazardous waste. And so our people have to wear these respirators that you probably saw during the pandemic in hospitals.
Kaiser acknowledged the situation and says it has conducted its own investigations and cleanups, as well as having more employee training, which state officials confirm it has done. The local DAs are still watching.
And we will be monitoring as well to make sure that Kaiser stays on the right.
Do better to protect our environment, our community, privacy of our patients in California.
Well, Kaiser's work has not done 120 self-audits every year and report the findings to investigators so that no future dumpster diving will be necessary. In Redwood City, Robert Honda, NBC Bay Area News.
These are not isolated instances of poor judgment. These are calculated schemes.
Did y'all hear that? So that's the type of disregard you're dealing with when you go on the Kaiser Permanente. You see they disregard your medical record. They put stuff over here. The government say they regulate, you know what I'm saying? They're going to audit them every 4 years. This been going on with me for like 5 years. Ain't nobody been doing no auditing on a medical record because it was impossible to miss what they did to me. Well, not impossible, but for somebody that got an eye, it should be easily to discern to enter. So, Dr. Mark E. Wilson, he's my primary care physician. I showed you guys, I have insurance. I showed you that I'm a Maryland Department of Environmental Inspector. And I showed you that Kaiser Permanente got a claim against me. The claim can't be satisfied because the court order haven't been enforced. The one from the Department of Justice hasn't been enforced, or the one from the state of Maryland has been. As a result, I've been trapped into the Affordable Care Act. And they kept on trying to push a spine surgery on me, wanted me to have spine surgery. So Dr. Mark Wilson had been promoting spine surgery ever since I walked in the door, in spite of the fact that he had diagnosed me with alcohol-induced neuropathy, which is covered under my policy. And so he kept. I'm sorry I lost y'all for a minute. But yeah, let's get back to, and I'll show you guys what actually took place. This was diagnosed 10/30/2020. Remember I told you they had a data loss on me from 7/28/2020. And remember I told y'all they was running a lot of tests on me. So on 10/30/2020, this when he diagnosed finally alcohol-induced neuropathy, about 3 months later. All right. Like I said, I had insurance. It's covered under my job. I'm a Maryland Department of Environmental Inspector. I provided them with the coverage. You seen when I talked to him, he said that he was putting it in the medical information, but that ain't what they was doing. It certainly wasn't what he was doing. What he was doing was this. Let's go over his clinical notes first. Everything I'm gonna tell y'all is gonna be right on point. We're gonna go over Dr. Wilson's clinical notes. Some of them. All right, we got Dr. Wilson's clinical notes. Chart review done. Spine surgery. 1/5/21. Dr. Mark E. Wilson. Chart review done. Spine surgery. All right, seen that. Seen that. All right. Told y'all, he kept trying to force me into having a spine surgery, which was totally inconsistent with the diagnosis and my coverage. But yet he was insisting upon it. And so, like I told you, I reached out to the Maryland Department of Health regarding my coverage. And they contacted me back, told me that the medical records had been altered. Although they didn't tell me how. And the fact that Kaiser Permanente, the Maryland Department of Health, United States Department of Health and Human Services had all been contacted and notified of the situation. But nobody acted on my behalf and still haven't. I reached out to multiple organizations trying to seek some relief. Right? And reaching out to OCR portal here, breach. They got a tracking number, breach submitted. Right? All these departments well aware of the crimes that are being committed in this healthcare system.